Hello, viewers. The incident I'm going to share with you today really makes me very heartbroken even now when I think about it. Can you imagine? When my own mom was lying in a bed in a rehabilitation and care facility, the advanced cancer had made it almost impossible for her to walk and she could only be kept alive by intravenous fluids. The whole family was scrambling to come up with a plan for follow-up care, and every decision was very difficult. Just then, the billing administrator at the nursing facility called me in to tell me the devastating news. Mom's EtnaMedicare Advantage plan would no longer cover the cost of her hospitalization. The administrator told me that there were only two choices: either to take my mom home, who was barely able to care for herself and had to receive ongoing medical care, or to cancel her current Medicare Advantage plan and switch back to the basic Medicare Advantage public plan, which would cover her hospitalization. But you know what? It's ridiculous that under the basic public plan, the insurance company is supposed to pay for the mom's continued hospitalization. It is clearly advertised that the Advantage plans are privatized supplements that provide better quality care. But when it comes to the time of greatest need, it is more realistic than anyone else, unwilling to give patients even the last bit of comfort and dignity they need before they die. Thankfully, my mom passed away before Aetna could kick her out of the hospital, but the experience really opened my eyes to the hypocrisy and cruelty of the American healthcare system once and for all. What happened to my mom is not an isolated case, and the so-called Medicare Advantage program is just the tip of the iceberg of this broken system. Today, I not only want to share my personal experience with you, but also want to take you step by step to trace the flow of funds behind this, to reveal how a vinyl record has changed the fate of the American healthcare, and why this so-called world advanced healthcare system has become the current money to cure the disease, no money to wait for the death of the model. First of all, we need to understand the U.S. federal health insurance. In the U.S., people who are 65 years old or older can qualify for Medicare. This insurance system is mainly divided into 4 parts, A, B, C, and D, accounting for 10% of the federal budget, which is very large. Among them, Part A is completely free, which is exchanged for the taxes paid by everyone who has worked for many years. It mainly covers the costs related to hospitalization, such as the core expenses of beds, nursing care, and medical treatment, and provides basic protection for the elderly for critical care. Part B is an optional rider, not mandatory, and the monthly fee is adjusted on an annual basis, based on the 2025 Trustees Report and the updated policy for 2026. The monthly payment is now $206.50, up 11.6% from the previous $185. The annual deductible has also risen from $257 to $288, an increase of 12%. Part B primarily covers preventive care and necessary outpatient treatment, including items such as routine physical exams, vaccinations, and outpatient surgeries, effectively making up for the fact that Part A only covers inpatient hospitalization. The most crucial point is that both Part A and Part B are directly managed by the government, and the use of funds is extremely transparent and public welfare. 98.6% of the budget, including the fees paid by taxpayers and a monthly fee of Part B, is really used for medical services, and the remaining 1.4% is used to pay for the salaries of employees who deal with clerical work, information entry, reimbursement, auditing, and other matters, resulting in a very low administrative cost and an extremely high degree of efficiency in the use of funds. But compared with Parts A and B, Part C, the Medicare Advantage program, follows a different logic altogether. It is not a supplement to traditional public insurance, but an alternative, integrating the coverage elements of A and B, yet operated by private insurance companies instead of being administered by the government. These insurance companies are very good at making profits, receiving financial allocations from the government on the one hand, and charging monthly fees from the participants on the other, which amounts to making profits at both ends. And in recent years, more and more people have been enrolled in the program. In 2014, the program's enrollment accounted for only 31% of Medicare enrollees, while by 2025, this has risen to 55%. This is largely due to the program's ability to attract enrollment by offering fringe benefits and limiting out-of-pocket costs. as well as the fact that many employers offer retiree health benefits through the program. When it comes to the promotion of this Medicare Advantage plan, it is really very misleading. Private insurance companies invest huge amounts of money to promote their plans. And the most common means of doing so is to get endorsements from celebrities who are well known to their elders. For example, actor William Shatner has filmed commercials conveying what he calls important information about Medicare benefits. The ads featured healthy, active seniors, hiking or picnicking, laughing, and promising lower deductibles and expanded coverage. That sounds pretty appealing, right? But these are all elaborate scams. They deliberately blur the line with government-public insurance to make elders mistake it as an officially recommended and better plan. But they never mention key information such as the quality rating of the plan and the hidden traps in the coverage terms. What's more, they also use gift cards, timeshare homes, and other perks preferred by elders to lure them into taking out insurance, which is really too bottomless. My mom was tricked by these advertisements to take out an insurance policy back then. Later, I took over my father's medical affairs. Every time I went to the CVS pharmacy to renew my prescription, I was met with a very breathless little test similar to a spoof BuzzFeed questionnaire that claimed to help me find the best Medicare plan. But no matter what information I enter, my dad's health, our coverage needs, the results always point to Aetna's Medicare Advantage, the plan that my mom was insured under before she died. The same plan that my mom was enrolled in during her lifetime, and which she was weaned off of on her deathbed. While there is no extensive industry survey data to prove how widespread this promotion is, this type of targeting is simply a misleading way to take advantage of the pharmacist's access, with no regard for the actual needs of the enrollees. In fact, it's no accident that the US health care system is what it is now, going back decades in history, which also involves to Ronald Reagan's. Time goes back to the late 1950s, when the United States Congress was seriously discussing a fully government-funded health care plan for the elderly, which can be said to be the prototype of universal public insurance. The program provided for national health care coverage for elders with a small upward adjustment in their Social Security payments. An earlier version also made it mandatory to ensure that all eligible elders were covered. But the program ran afoul of vested interests such as private insurance companies and the American Medical Association. The healthcare system at the time was already so greedy that they profited handsomely from unreasonable pricing and monopolizing services. And they certainly didn't want to see a fair public insurance scheme emerge. So they launched a covert operation called Operation Coffee Cup, the key ingredient of which was a vinyl record. And then sent it to the families of doctors across the country, asking them to play it at their friends' parties to persuade them to oppose the health. It was like a Tupperware party for predatory private health care. On the record, Reagan disparaged the public insurance program as a tool for controlling the public. He also makes the alarmist claim that if the bill passes, people's children will not be able to choose where they want to go to school or work in the future, and will have to be assigned to them by the government. In addition, he also distorted the facts, accusing the supporters of the bill of falsely claiming that not enacting the legislation would mean abandoning the elderly, and claiming that such an act was ridiculous to the extreme. But then, what happened to my mother is a true depiction of abandonment, isn't it? Although some version of the bill was eventually passed, laying the groundwork for what is now known as Medicare, its key flaw remained. It was not mandatory, which allowed private insurance companies to retain considerable power. During Reagan's presidency, the Tax Equity and Fiscal Responsibility Act was signed into law again, officially allowing Medicare to partner with private insurers. This meant that actor Reagan provided the industry with a public opinion base to make public insurance optional, and President Reagan gave them the power to underwrite public insurance enrollees. This eventually led to the creation of the original Medicare Parts A, which was renamed Medicare Advantage in 1996. In the decades since, private insurance groups have continued to infiltrate the healthcare system, rooted in a game of chance and fueled by Reagan. The truth is that Medicare Advantage is not as good as it is advertised to be, but rather has many harmful effects. It's not very friendly to the enrollees or the taxpayers. First, in terms of cost, instead of saving money, it costs taxpayers more money. Evaluations by authoritative organizations have shown that patients enrolled in the program cost taxpayers between $300 and $1,400 more than traditional Part A and B public insurance. In addition, studies have found that the plan charges the healthcare system more corrupt excess fees than all conventional healthcare programs combined. These overages are fraudulently collected by private insurers through irregularities such as misrepresenting patients' conditions, exaggerating medical needs, and double reporting costs. Although updated projections beyond 2025 are not yet available, the pressure of private insurance as a drain on the public coffers is sure to increase as enrollment continues to grow. In addition, the quality of the scheme's services is a cause for concern. The most direct manifestation of this is its much higher rate of denial of pre-authorization requests and necessary treatment than traditional public insurance, especially in rural hospitals where medical resources are scarce. Pre-authorization is a critical part of health insurance reimbursement, and when denied, participants are unable to receive reimbursement and many necessary treatments are not available. Studies have shown that 15% of the nearly 56 million medical denials, or $150 million, were due to the program's coverage rules, which are more stringent and unreasonable than those of traditional Medicare. These rules are very harsh. For example, it restricts the treatment of specific diseases, strictly controls the scope of drug use, and mandates treatment facilities, resulting in the reasonable needs of many enrollees not being met. In addition, the scope of its medical services is much smaller than that of traditional public insurance, and the number of designated hospitals is limited, especially in the areas of specialized and critical care, where the coverage of quality resources is seriously inadequate. The coverage of doctors in the network is also very small, and it is very difficult for elderly people with mobility problems to find a suitable doctor. This was the case with my mom at the time, who needed continuous care from a rehabilitation care facility, but Aetna's plan outright refused to pay. If she hadn't switched back to traditional public insurance, she really would have been without medical care. Even more exaggerated are the administrative costs. While the administrative cost of traditional public insurance is only 1.4%, the administrative cost of the program is 15%, more than 10 times the cost of traditional public insurance. Instead of being used to improve the quality of service and optimize the reimbursement process, the money has become mainly salaries and corporate profits for executives of private insurance companies. After all, insurance companies are for-profit enterprises and making money is the most important thing. They spend so much money on non-medical aspects, resulting in the crowding out of medical resources, and the ultimate victim is the insured. Now that the American healthcare system is moving in the direction of full privatization, the future is really very worrying. They want to promote the Medicare Advantage plan so that everyone can participate in this kind of private program. There is no hope for any fairer, more universal healthcare program. Private insurance groups will become more entrenched, more taxpayer money will flow to them, and the rights of the insured will become less and less secure. With a new administration and a leader who claims to be an expert negotiator, traditional public insurance has long been unable to negotiate costs with healthcare providers. Although public insurance has been given the right to negotiate for some high-priced medicines under the 2025 reform, it is still at a disadvantage in negotiating the overall cost of healthcare services, and has not been able to reduce costs across the board through centralized purchasing and bulk pricing. On the other hand, private Medicare Advantage plans are able to negotiate with service providers to obtain lower prices. This inequality of power is unconscionable. Meredith Arth has been advocating for Medicare Advantage. They have appropriated the mantra of Medicare advocates and packaged private plans as Medicare for all solutions, when in fact they are basically designed to promote a purely for-profit Medicare system. This will only strengthen the monopoly of the private insurance groups and increase the profits of the insurance companies, while we, the insured and the taxpayers, will have to pay a higher price for it. In fact, many knowledgeable people have suggested that the fundamental solution to this problem is to replace the existing Medicare Advantage plan with a fully nationalized Medicare plan that provides equal health care coverage for all. not just for seniors who voluntarily enroll. A nationalized plan could take away the negotiating advantage of healthcare companies, who would then have only one client, the government. The government can negotiate fairly with the service providers on behalf of the entire population, thus lowering the cost of healthcare. It can also cut off the avenues through which the companies can profit from the sick and the taxpayers, so as to avoid the flow of public funds to executive salaries and corporate profits, and to really spend the money on healthcare services. Here, I would like to make it clear that even if the Medicare Advantage program had worked perfectly, my mother might not have survived. Her condition was already very critical when she was admitted to the hospital, and the treatment of advanced cancer is already full of uncertainties. I don't blame her death on the greed of the insurance companies, but it really angered me to see how easily they refused to provide treatment under the so-called better plan on my mother's deathbed, when the regular government program would have protected those benefits. It also made me realize that if the new administration really wants to keep its promises to the people, it must confront the flaws in the healthcare system and target insurance companies, healthcare providers, and all the corporations and individuals who speculate and profit from the healthcare system. Now, more and more people have recognized the monstrosity of the U.S. healthcare system and are speaking out in various ways to push for reform. In fact, the entirely government-run VA healthcare system has proven that a government-led healthcare system. In fiscal year 2025, more than 2.9 million veterans received services through telehealth, with 91.7% of users satisfied with the services and 89.1% trusting the telehealth services. Overall, 79.5% of veterans who used the system expressed trust in it, which is a strong testament to the fact that a government-run healthcare system can also provide high-quality, high-satisfaction services. Achieving real reform will require not only government policy adjustments, but all of us working together. I hope we can pay more attention to this topic. If you have heard of similar healthcare scams or have had similar personal experiences, please feel free to share them with me in the comments section. And please don't forget to like and subscribe to my channel to work together to expose injustice and push for change. That's all I have to share for today. Thanks for watching, and we'll see you next time.